Diverticular disease. Introduction. Diverticular disease consists of three conditions that involve the development of small sacs or pockets in the wall of the colon, including diverticulosis, diverticular bleeding, and diverticulitis. Definition. Diverticulosis. Diverticulum, more than one is called diverticula, is the development of a protrusion or outpouching of the inner lining of the large intestine, colon. Although these sacs can form anywhere in the colon, they are most common in the sigmoid colon, part of the large intestine closest to the rectum. They are usually characterized by a small pouch with a thin neck. When diverticula are present, the patient is said to have developed diverticulosis. The condition can lead to more serious issues including diverticulitis, perforation, the formation of holes, stricture, a narrowing of the colon that does not easily let stool pass, fistulas, and bleeding. Diverticular bleeding. Diverticular bleeding occurs with chronic injury to the small blood vessels that are next to the diverticula. Diverticulitis. Diverticulitis occurs when there is inflammation and infection in one or more diverticula. This usually happens when outpouchings become blocked with waste, allowing bacteria to build up, causing infection. An inflammatory condition of the colon thought to be caused by perforation of one of the sacs. Several secondary complications can result from a diverticulitis attack. When this occurs, it is called complicated diverticulitis. Risk factors causes. Older patients. Smoking. Sedentary lifestyle, lack of exercise. Obesity. Diet that is low in fiber and high in animal fat. Some medications, steroids, opiates, and non-steroidal anti-inflammatory drugs. Fecal impaction. Microbiota disruption. The most commonly accepted theory ties diverticulosis to high pressure within the colon. This pressure causes weak areas of the colon wall to bulge out and form sacs. A diet low in fiber and high in red meat may also play a role. Currently, it is not well understood how these sacs become inflamed and cause diverticulitis. Pathophysiology. Signs and symptoms. Patients with a history of diverticulosis usually have no signs or symptoms of illness. Potential symptoms of diverticular disease include pain in abdomen, bloating, diarrhea, constipation. Diverticulitis can cause symptoms ranging from mild to severe. These symptoms can appear suddenly or they can develop gradually over several days. If client develops diverticulitis, he might experience constant or severe pain in abdomen, nausea and vomiting, fever and chills, blood in stool, bleeding from rectum. Abdominal pain is the most common symptom of diverticulitis. It will mostly likely occur in the lower left side of abdomen. But it can also develop in the right side of abdomen. Diagnosis. To diagnose diverticulitis, the doctor will likely ask client about symptoms, health history, and any medications that he takes. They'll likely perform a physical exam to check abdomen for tenderness or, if they need more information, a digital rectal exam to check for rectal bleeding, pain, masses, or other problems. Several other conditions can cause symptoms that are similar to diverticulitis. To rule out other conditions and check for signs of diverticulitis, the doctor might order one or more tests. Tests can include abdominal ultrasound, abdominal MRI scan, abdominal CT scan, or abdominal X-ray to create pictures of gastrointestinal, GI, tract. Colonoscopy to examine the inside of GI tract. Stool test to check for infections, such as Clostridium difficile. Urine test to check for infections. Blood tests to check for signs of inflammation, anemia, or kidney or liver problems. Pelvic exam to rule out gynecological problems in women. Pregnancy test to rule out pregnancy in women. If client has diverticulitis, these exams and tests can help the doctor learn if it's uncomplicated or complicated. Management. Uncomplicated diverticulitis can typically be treated at home. doctor might encourage client to make changes to his diet. In some cases, they might prescribe medications including antibiotics. If client develops complications from diverticulitis, he will probably need to visit a hospital for treatment. He may be given fluids and antibiotics through an intravenous line, depending on the type of complication. Dietary changes. To give digestive system a chance to rest and recover, the doctor might suggest avoiding solid foods and following a clear liquid diet for a few days. If symptoms are mild or have started to improve, client may be able to try eating low-fiber foods until condition gets better. As condition improves, doctor will likely encourage client to add more high-fiber foods to snacks and meals. Medication. To reduce pain or discomfort from diverticulitis, the doctor might recommend over-the-counter pain medications, such as acetaminophen, Tylenol. If they suspect that client has an infection, they'll prescribe antibiotics to treat it. These include metronidazole, Flagyl, Flagyl-ER, amoxicillin, moxifloxacin. It's important to take full course of prescribed antibiotics, even if symptoms improve after the first few doses. Surgical management. If client experience multiple episodes of diverticulitis that can't be effectively managed with dietary changes and medications, doctor might recommend surgery. Surgery may also be used to treat complications from diverticulitis. Needle drainage, where a needle is inserted into the abdomen to drain an abscess of pus. Surgery to drain an abscess of pus, repair a fistula, or remove infected segments of the colon. Bowel resection with anastomosis. During a bowel resection with anastomosis, a surgeon removes infected segments of colon and reattaches the healthy segments to each other. Bowel resection with colostomy. In a bowel resection with colostomy, the surgeon removes infected sections of colon and attaches the end of the healthy section to an opening in abdomen, known as a stoma. Both procedures can be performed as open surgery or laparoscopic surgery. Nursing management. Nursing diagnosis. 1. Acute pain related to inflamed bowel as evidenced by patient rates pain at 8 October on pain scale and states abdominal cramping and tenderness in abdomen. Desired outcomes. Patient will report a decrease in pain from 8 to 0 on the pain scale by discharge. Interventions. Rationale. Assess level of pain using appropriate pain scale. Assess pain 30 minutes before and after pain medication is given. Using an appropriate age pain rating scale will help the healthcare providers monitor the level of pain and adjust pain medications as needed. Administer pain medications as prescribed and indicated. Analgesics are helpful in relieving pain and helping in the recovery process. Check for number of bowel movements at least once per shift. Immobility caused by pain may decrease the parasympathetic stimulation to the bowel. Incorporate non-pharmacologic measures to assist with control of pain. Ideally, the use of comfort measures will distract the patient from pain and may increase the effectiveness of pharmacological measures. 2. Risk for infection. Desired outcomes. By discharge, the patient will remain free signs and symptoms of infection. Interventions. Rationales. Assess vital signs including temperature every 4 hours and as needed. Report any abnormal findings to the healthcare provider. Fever is often one of the first signs of infection. Assess mental status and level of consciousnesses every 4 to 6 hours. Mental status changes, confusion, or any deterioration from baseline can signify infection. Report and note any abnormal laboratory values, i.e. elevated WBC count, to the healthcare provider. Certain abnormal laboratory results could be an indicator of infection. Complications. Fistula formation. This is an abnormal connection between another part of the body and the colon. Perforation. This is a tear in the colon. Peritonitis. Stricture formation. This is a narrowed area in the colon. Abscess formation. Area that is filled with pus or infection. Phlegmon. An infected area that's less well confined than an abscess. Intestinal obstruction. a blockage in intestine that can stop stool from passing.
So guys, thanks for watching my video. You can like and comment on my video, but don't forget to subscribe my YouTube channel to watch quality content like this. Thank you guys.